Vitamin D deficiency, which is another name for low vitamin D levels, can manifest itself in a wide variety of indications and symptoms. Because vitamin D is necessary for the maintenance of strong bones and plays a part in a variety of other biological activities, a lack of vitamin D can lead to a wide variety of health problems. The following are some common symptoms of vitamin D deficiency. 1. Aches and pains in the bones and muscles. Vitamin D is essential for the absorption of calcium and the preservation of bone health. A deficiency can lead to weak and painful bones, which may manifest as generalized aches and muscle discomfort. 2. Weariness. Those who have low levels of vitamin D may experience continuous weariness as well as an overall sense of weakness. 3. An increased likelihood of becoming sick. Because vitamin D is involved in the function of the immune system, a deficiency in this nutrient is associated with an increased risk of developing diseases and infections. 4. Alterations in mood. There may be a connection between low levels of vitamin D and mood disorders such as depression and seasonal affective disorder, also known as SAD, according to some studies. 5. Hair loss. Vitamin D deficiency has been linked to instances of hair loss, also known as excessive hair shedding. 6. Impairment in the body's capacity to heal wounds and recover from injuries. A deficiency in vitamin D might slow down the body's ability to heal wounds and recover from injuries. 7. Problems with bone health. Vitamin D deficiency can, in severe situations, lead to illnesses such as osteoporosis and osteomalacia, which are both characterized by a softening of the bones, as well as an increased risk of fractures. 8. Weakness in the muscles. Weakness in the muscles and a general decrease in strength can be a result of not getting enough vitamin D. 9. Reduced cognitive function. Some research suggests a possible link between low vitamin D levels and cognitive impairment or an increased risk of conditions like Alzheimer's disease. 10. An increased risk of chronic diseases. A deficit in vitamin D has been linked to an increased risk of a number of chronic diseases, including cardiovascular disease, diabetes, and some malignancies. It's important to note that the symptoms of low vitamin D can be subtle and nonspecific, and they may vary from person to person. If you are experiencing any of these symptoms or are concerned that you may have a vitamin D deficiency, it is in your best interest to speak with a qualified medical expert. They will conduct a blood test to evaluate your vitamin D levels and then make treatment recommendations, which may include alterations to your diet, the addition of supplements, or additional time spent in the sun.